I want to first of all thank God for the opportunity to present the scorecard and the stewardship of the Ministry of Health to all of us by essence. Permit me to acknowledge the chairman of the Health Committee, Bayelsa State House of Assembly, Secretary to Government, Commissioner for Information as Chief Host here today, the Chief of Staff, Government House, the Head of Service, my colleagues in the State Executive Council, special advisors, senior special advisors, chairmen of parastatals and agencies here present, other top government functionaries, invited ladies and gentlemen, gentlemen of the press, distinguished ladies and gentlemen. It's my pleasure, honor, and privilege to present to you the scorecard of the State Ministry of Health from the year 2012 to date. And I've captioned my presentation, Access to Quality and Affordable Healthcare for All Bayelsans, Achievements of the Restoration Government from 2012 to 2017. Our vision statement is that all citizens of Bayelsa State will have access to quality care at a cost that they can afford, irrespective of their class and creed. And the mission statement of the ministry, which is also part of the restoration government agenda, is to develop, implement appropriate policies, programs, as well as undertake other necessary actions that will strengthen the health system to be able to deliver effective, quality, and affordable health. I'll dwell next on the landmark policy objectives that we have achieved in this period. We have assessment of the state healthcare infrastructure, which is very known to most of us. Development and construction of world-class healthcare infrastructure and equipment. Establishment and commencement of Bayelsa State Health Insurance Scheme. For your information, Bayelsa State, as we speak, is the only state that has fully commenced a health insurance scheme. And I think that goes to show the commitment of the restoration government. Most other states are doing it in bits and pieces, but we were able to take the bull by the horn, and we have done it fully. And as I speak, we all know what is happening. Yes, most of what we're doing now is mostly in the formal sector, that is civil servants, and then the organized private sector. But arrangements and measures are being put in place to ensure that this is cascaded down to virtually all the nooks and crannies of this state. And as time goes on, we'll begin to see some of these measures unfolding and everybody benefiting from this scheme. The essence, like we've always told all of us, is that nobody plans to be sick. But when you are ill, it is very important that you are able to access healthcare without putting your hand in your pocket. And that is the whole essence of health insurance. We're also establishing and strengthening healthcare manpower training. For healthcare, like you know, there are always advances, and as a result of that, health workers need to be constantly trained and retrained to ensure that we are giving best practices that are acceptable internationally, and that is one of the mandates that we have ensured that we put in place in the State Ministry of Health. We're also in the advanced stages of setting up a primary healthcare development board or agency. Unfortunately, Bayelsa State, as we speak now, is the only state that have not established that agency. But the good news is that the chairman of the health committee is here, and we've been discussing, and she has assured me that latest by February, that bill will be on the table of His Excellency for assent. There are a lot of things that are going on in the health sector that we have not been making too much noise about. But I want to assure you that there is a silent revolution going on in the health sector. I'm sure some of you have never heard that we have what is called a Bayelsa Telehealth Initiative. What that initiative is all about is to ensure that when people are ill and they need to access health care, we all have mobile phones. You can just call to your nearest primary health care facility and you'll be attended to and be told exactly what to do so that you don't start doing self-medication, which at the end of the day has caused a lot of health problems for us in the state because of our health-seeking habits. We've been severally, courtesy the Commissioner for Information, we've been on radio, we've been on other media, social and otherwise, trying to ensure that our activities are out there for all of us Bayelsans to take advantage of and ensure that we be in good and sound health. There is a major initiative or program that is going on in the state that has impacted tremendously in the health of Bayelsans. And that is a program that is done in collaboration with the Federal Ministry of Health, the World Bank, and the National Primary Healthcare Development Agency. It's called the Saving 1 Million Lives for Result program. And I want to announce to us that despite the handicap that we had in the sense that we didn't have an existing primary healthcare board or agency, Bayelsa State was able to compete with all the other states in the Federation, and because of the improvements in our indices, we were awarded $1.5 million for the feat that we achieved. We have also, using this program, commenced what we call the Governor Dickson Safe Delivery Project. Recently, His Excellency Honorable Henry Seriake Dickson, who is the leader of the restoration team, made some pronouncements saying that all pregnant women in Bayelsa State from this year are responsibility of the government. And that is a very serious pronouncement. And as a result of that, we have put in place measures to ensure that every pregnant Bayelsa woman will come on to this program, will take responsibility for them from the day they are pregnant until the day they deliver. And the reason why the governor is doing all this is because a group of very concerned people came, having looked at our health achievements. They started wondering why we have a very high maternal and infant mortality index that was higher than the national average. And when they came, they were able to have an audience with the governor, and they were able to tell him the reason. And it's not far-fetched. The reason is not far-fetched. It's just the health-seeking habit of our women. And I know they are attributable to social, cultural beliefs. Because most of our women, both the uneducated and the educated, still have this very strong belief that when they want to deliver, the best place to go is to a traditional birth attendance. Time will not permit me to go or delve into the atrocities that these health-seeking habits have created in increasing our mortality rate, particularly for women who want to deliver, and as a result of that, their children also. Can give you very graphic evidences and details, but this is not the time for that. I want to also inform us about the commencement of a Governor Dickson's eye care project. As I stand here, I'm putting on glasses. I've been wearing glasses since I was in primary school. And the reason why we have embarked on this initiative is because many of our children, for whatever reason, suffer from eye problems that they don't understand, particularly those of them who are in school. And we have taken the bull by the horn by going through, mostly at the secondary school level for now. It is a program that is going to be sustained. And I have been in discussion with my colleague, the Commissioner for Education, and we are going to ensure that by the end of this year, most of our children who have these eye problems, who can't compete favorably with their peers in school, will be given free eye glasses at no cost to them and their parents. And I think because of the passion that the governor has for the education sector and for the building of the minds of our children, I think this will be an added fillip to whatever we are going to achieve in the future for our children in terms of education. Another very giant leap that we are taking in the health sector is the commencement of the one functional primary health care center per ward strategy. The ministry, by the directive of His Excellency, has embarked on a tour of facilities in all the local government areas, and the reason this directive was given is because of the passion His Excellency has for the health of all Bayelsans, because he says he wants every Bayelsan at that level, at the ward level, to be able to access health care. And like we all know, over 70% of whatever we do, because the health care system is graded into three: primary health care system, the secondary, and the tertiary. Most times at that level, that is where we prevent things that might snowball into, very dangerous consequences for our people. So we want to establish a functional primary health care center in every political ward in this state. And we have commenced on that journey. We have visited all the local government areas. We have interacted both with the political heads, that is the party, the local government chairman, the community development committees, the women groups, the traditional rulers, the opinion leaders in all the local governments, and we are coming up with a blueprint which is going to dovetail into some of the measures that we are taking at the state level to ensure that our people are able to access affordable and kind health care from this year. And I believe with the assurance that I've got from the governor, we are going to start ensuring that our people, particularly the health workers, will not become absentee workers like they've been in the past. And we are going to ensure that we provide living accommodation for all of them so that they will have no excuse to say that because of lack of accommodation, they cannot stay at the health facilities to ensure that they provide health care for our people. Having said that, I want to take a brief on some other projects, very iconic projects that have gone on in the state. I'll start with the Bayelsa Specialist Hospital, where we have a renal center, a cardiovascular center, and a stroke center. When the Secretary to Government was speaking, he talked about the National Chairman, PDP South, bringing his mother to Bayelsa for the insertion of a pacemaker. We are doing far more than inserting pacemakers at the Bayelsa Specialist Hospital. In the past, diabetes is one of the commonest causes of morbidity in this state. Most times, like you all know, most of these people end up becoming amputees. That is because diabetes has ravaged their body, and particularly their toes. And if those toes or those parts of the body are not amputated, eventually it will be the cause of their death. But I want to inform you today that people with diabetes don't need to have that fear again, because at this center we are doing what we call recanalization surgery, where we bypass the blocked vessels of the affected limb, and we are able to take blood back into that limb, and that limb is saved, and that patient will walk about without undergoing any surgery. And that is a feat that we perform here in Bayelsa State. And all these are the brainchild of the investment that the restoration government, ably led by our governor, has done for us. Apart from that, we have what we call a CAT lab. I don't think any state has that equipment, or we don't have, even if there is maybe one or something. And like you know, most times in this country, even when we have invested in high watt equipment, high falutin medical equipment, we don't even put them to use. But at the stroke center, all our equipment are being put to use. So when you have a stroke, like stroke is one of the commonest conditions we have in these climes. If you come in at the appropriate time when you have the stroke, it is possible for us to reverse the consequences that you will have if you don't come to that center on time. What I'm trying to say is this. Most of us know the consequences of stroke. It's either you are paralyzed on one side of your face, on one side of your arm and leg, or even all your limbs, or at the worst, the patient can die. But if that patient is brought to our center within an hour of that event, it is possible for us to revert the processes that have taken place because we have a cath lab that we can ensure that blood flow, particularly to the brain, is sustained, and that patient will walk away healthy from that center. That's, to me, is a very major achievement of this restoration government. In all the local government areas, we have modern referral hospitals built. The essence of these referral hospitals that are located specifically in Ekerimo, Sabama, Kayama, Oporoma, and Ogbia, the essence is to ensure that when we have problems at the primary healthcare level where we cannot carry out certain procedures, we can send them to these referral centers and the problems will be solved at that center. So the restoration government has thought it wise to ensure that all the local government headquarters are manned with such hospitals. The other ones that I did not mention in Nembe, in Brass, and maybe Yenegua, is because we already have facilities that are as good as the new ones we have built. And those centers are going to be manned in such a way and used in such a way that at the end of the day, we'll find out that our health-seeking habits will be dramatically turned around, courtesy the efforts that have been put in by the restoration government. I'll go on to the drug mart, or the drug storage and distribution center in Yenegua. Most of you must have been seeing that edifice located on Sani Abacha Road, but you might not understand the significance of that drug storage and distribution center we call the drug mart. The essence is that the restoration government had looked at the problems that have been staring us in the face in terms of the kind of drugs that are available to us as citizens in this state. And we have seen that the only way we can ensure that our people get drugs that are not counterfeited, drugs that are not fake, is to ensure that we provide some kind of quality assurance. As a result of that, what we have done is this. Every manufacturer in this country that manufactures drugs will have a desk in this drug mart. So all our hospitals, all our pharmacies, all our patent medicine stores will collect or purchase their drugs from this center. For the government facilities, the center will even be able to tell you when your stock is expiring, when your stock is finishing, so that you can restock and all that. So we have all the electronic ways and means of ensuring that we're able to monitor the use of drugs, particularly in our government facilities, so that we keep, we put a stop to the menace of these counterfeit and fake drugs, and also to ensure that particularly the drugs that are easily abused are not put out there in the society through some nefarious activities of people, and our children end up becoming drug addicts and so on and so forth. We are doing that in conjunction not only with state government hospitals, we are doing that in conjunction with the National Drug Law Enforcement Agency, and also with NAFDAC. They all have desks in this facility. And I want to say that Bayelsa State is the first state in the Federation to have this kind of facility. So I think we are making progress, and we are doing so slowly but very steadily. Apart from that, we have what we call an ATM center. It's not for money. An ATM center at the 500 hospital premises. If you go to the 500 hospital premises, if you approach it from this axis, is the first building on your left. What we have there is, we have the state public health lab. Most times, some of us don't even know what those labs do, but they are very important in the sense that for people who eat from public places, that lab is to ensure that we're able to monitor and ensure that the water you drink, the food you eat, the people who handle them, we're able to go take samples and test to see whether they harbor conditions that can cause public health epidemics. That center does that. That center also takes care of a lot of research on malaria, tuberculosis, and HIV/AIDS. That is what is done at that center. And apart from that, we also have our international partners. One thing with health that most of us don't understand is that there's a lot of money that goes into public health. And most of these monies come from international donors. And these international donors come to partner with us to ensure that we prevent most of the diseases that will ordinarily kill us. And it's a global thing, because if one person is sick here and he travels abroad, I'll give you an example. If you have tuberculosis and you travel to a Western country and they know that you have tuberculosis, they won't allow you to go into that country. So they are interested in whether people who are coming into their countries from other countries have diseases that will spread in their own countries. So they are ready to spend money to ensure that they curb whatever happens in other countries so that diseases don't spread all over the world. I will allude to that when I get